Hello, I'm Urologist Ömür Erdem Akkaya. Today we're going to do a video about testosterone replacement therapy and figures. Obviously people sometimes get obsessed with the figures. The most important thing in testosterone replacement therapy is to achieve a testosterone level at which the patient feels good. One of the most important reasons why this reference range, which is between 220 to 900, is very wide is this. Some patients may have no problems with testosterone levels of 220, the patient may feel fine. With levels of 200 to 220, he can live without any problems. Of course, the most important feature of this person is that they are usually young and healthy. In other words, testosterone levels may be higher in young people than in the elderly. But if the person is young, he can make better use of the testosterone in the blood. Because androgen receptors are more sensitive. If the person is also thin, there is less loss of free testosterone due to estrogen aromatization. As we get older, gain weight, have bad habits, have sleep disorders, have problems in the endocrine glands such as thyroid and adrenal glands, have chronic diseases, use chronic medications, of course we can say that testosterone does not work normally in the body. When you give testosterone to a diabetic or a normal patient, you will not see the same result. Here, if the patient feels good at levels of 200 to 300, there is no need to do anything. But we can say that these people feel much better at 800 to 900 levels, again within physiological ranges. Therefore, one of the most frequently said things is, my testosterone is 300, I need to increase it to 600. But the impulse here comes from this: these people usually do sports, and since they do sports, they cannot benefit from sports for a certain period of time. And he wants to increase his testosterone to higher levels within physiological levels. So this may be true, if a person is doing sports, he can see the difference when his testosterone is 600 to 900. But when he uses it anabolically, usually, when he uses 200 mg of enanth weekly, his total testosterone level goes over 1500. So it comes to the anabolic level now. When one tries to increase testosterone due to erectile dysfunction or loss of sex drive, one doesn't always get the same answer. Because there are many other factors other than testosterone levels in loss of sex drive and erectile dysfunction. Everything from lifestyle, nutrition, sleep, couple relationships, feelings of hatred and anger, everything can affect loss of sex drive and erectile dysfunction. Therefore, in testosterone replacement therapy, we try to treat the symptoms and complaints of the person. We try to improve the general health and well-being of the patient. It is very important not to stick to figures, friends. When a person loses weight, even if the total testosterone level decreases, the patient will benefit more because the free testosterone level will increase. If a person uses alcohol and quits, if he improves his sleep quality, he will always benefit more, even with low testosterone levels. Of course, we are not talking about this to build muscle mass. Unfortunately, free testosterone is very important in building muscle mass. That is a completely different, sports-related situation. As I said, this is the situation related to loss of sex drive and erectile dysfunction in testosterone replacement therapy. I would also like to answer a question that came in. I started Testosterone treatment for testosterone deficiency and used one every month. In the third month my doctor told me to stop. What should I do? Friends, if you use Testosterone, after stopping it, it will drop below your initial testosterone level. And your complaints that caused the testosterone treatment will most probably come back. If you are young, you may be given a treatment to stimulate the release of testosterone from your testicles. Such a treatment can be used so that there is no dependence on testosterone. But after a certain age, testosterone replacement therapy is done continuously. There is no end, especially if you use testosterone. There is no end, you will take that treatment until you die. You continue in that way. If you use testosterone in testosterone replacement therapy, sperm quality deteriorates, it can cause infertility. But we can say that there are drug treatments that will reactivate the testicles after stopping. In general, this is how it is. Thank you for listening.